The following podcast is a Dear Media production.
Ladies and gentlemen, put your hands together for your queen.
Welcome to Dr. Jackie's Point of View. I'm your host, Dr. Jacqueline Walters. Now, as an OBGYN, I have seen and heard it all. No topic is too taboo for this doctor. Join me as we embark on an eye-opening journey to self-discovery. Let's get to it. Hey guys, welcome to Dr. Jackie's Point of View. This is another episode with Dr. Jackie, and today, ladies and men, I got something good for you. It's probably going to end up being 2 or 3 episodes, but we're going to start right here. I have heard you, I have read your messages, and I hear you ladies in my office, and I even got all the DMs to go. Women want to talk about it. And what are we talking about today? Low sex drive in women. Now, you know that's what I see all day long is women, and I might talk about the men a little bit, but I'm going to start with the women. So let me start with saying, and I'm going to share a little bit of my own business. Low sex drive is not uncommon. We're in a pandemic. Some of you are working from home. Some of you are even at home with the kids all day. Just life has changed a lot, and low sex drive I hear about a lot. So I want to talk about it. Y'all ready? All right, so let me share with you. What is low sex drive? Now, a medical term for it is hypoactive sexual desire disorder. And what is it? If you are frequently lacking sexual thoughts or desire, and this is causing you some personal distress, that's low sex drive. And let me clarify. There are some asexual people out there who never think about sex, don't want to have sex. And I even have a few in my life. And I'll clarify. I know patients and friends and family members who just never think about sex. And these people are asexual and it's not causing them any personal distress. So they don't really have a low sex drive. But if you lack the desire or the thought of sex and it's bothering you or causing a problem in your relationship, that's low sex drive. Now, whether you fit the medical diagnosis or not, I do encourage you guys to talk to your doctor. As a physician, I ask a lot of questions around low sex drive because as you'll continue along this podcast with me, you'll learn that there are a lot of reasons that we as women and probably men lack an interest in sex. So if your sex drive isn't as high as you would like it, you need to get help. So let me start. When you present to your doctor, as a physician, the very first thing we're going to do is take a medical history. Like I said, I ask a lot of questions. Are you happy in your relationship? Has there been any infidelity on either side, you or your partner? Are you working 24/7 and not getting any rest? Is your partner somebody you're attracted to? Just things that could impact your sex drive. Now, as the doctor, we're definitely going to do a history, but we're going to do a pelvic exam. Because during your pelvic exam, as the doctor, we look for signs of physical changes that can contribute to your low sex drive. For example, if the vagina or the genitalia starts to thin, and it's going to happen, take it from me, ladies, as we age and mature, the vagina is going to thin and change. The labia will also change as well. If there's vaginal dryness, if you're taking medications that may create vaginal dryness, if as a mature woman and your hormones are off, and sometimes even using certain lubricants can lead to vaginal dryness. And this can contribute to pain. And I can tell you now, if sex is painful, your sex drive will be low. So that's some of the stuff that we will look for in a pelvic exam. Also, we do recommend certain tests. We will check your hormone levels, your follicle stimulating hormone, luteinizing hormone, your estrogen level, testosterone level. We'll check your thyroid. We'll check for diabetes, high cholesterol, liver disorders, because a lot of your hormones have to do with the fact that your liver is functioning properly. We'll also sometimes refer you out to a specialist. Now, I will say as a physician, as an OBGYN, I do talk to women and I do make recommendations to a certain level, but sometimes a specialized counselor or a sex therapist may be able to help you evaluate emotionally and relationally whether there are factors that could contribute to your low sex drive. So I'm going to take you back to the top. your low sex drive is if it is causing you personal distress or distress within your relationship. That's when it becomes an issue and you need to talk to your doctor. You'll get a thorough history taken. You'll have a pelvic exam. In most cases, we'll order testing. And in some cases, we'll even refer you out to a therapist or a specialized counselor. Now, once we do all this, where do we go from there? Most women benefit from a treatment approach that is aimed at what's causing the problem. Makes sense to me, right? If we can identify what's the problem, and then a lot of times we can apply treatment that will fix the problems. Some recommendations sometimes, as I said, from your counselor will be to go back to your doctor and talk about medication. What would sex education do? Talking with a sex therapist or a counselor who's skilled in addressing your sexual concerns is important because a lot of times they talk about the sexual response and the techniques associated with it. For example, and men, I'm talking to you, if you are premature ejaculate and you get in there and within a minute you're done, let me tell y'all something. As a woman, that ain't no fun, okay? And they talk about squeeze techniques. They even talk about what to do if maybe your male partner isn't as well endowed as you would like him to be, how to make that work. So a therapist or a counselor will provide recommendation. They will give you reading materials. They sometimes will give you couple exercises. And most importantly, they will address those relationship issues that will help with the intimacy and desire that you so desire. Now, medication. So we've done your history and we have identified what's causing the problem. Today, I told you I want to be open and honest, and I don't want to just stay so medical. Men and women, when there is a problem in the relationship, whether your husband or your partner isn't helping you as much as you think you need help, one, talk to your partner. We have to find a way as women to be able to be transparent with our male partners and our female partners and say to them that this is what is causing me this. Because I'm honest with my husband. I have worked all week long. I've been on call. I'm tired. I have to come home and clean that darn glass table that you mess up all day and get the dishes out the sink and do all the stuff that I have to do. I'm not feeling very sexual at night. Or if I've asked you a question and your response was a little bit more snippety than I thought it would be, as a woman, that's a turnoff. And a lot of times, well, no, all the time, sex starts in our head. We as women, we need to feel like you want us. We need to feel like we want you in most cases. Now, there are some women, they are like me and they look at it and, they are turned on. But for women, most of the time, this starts in our head and our heart. So I will tell you that is the part you definitely need to make sure you address with the therapist or the counselor, in that these are the things that turn me off, that lead to my low sex drive.
I'm Ariel Laurie, host of the Blonde Files podcast, where every Wednesday I cover all things wellness. After nearly dying from drugs and alcohol 6 years ago, I've been on a mission to live my best, most fulfilled life, and I'm sharing everything with you. From how to achieve optimal health, well-being, and fulfillment to the best beauty tips and even cosmetic procedures, I cover it all with raw, candid conversations with experts and inspirational guests. Make sure to subscribe to the show so you never miss an episode.
Now, medication. Your doctor will want to review which medications you're already taking, because you would be surprised some of the medications that can lead to low sex drive. For example, if you're taking Paxil or Prozac or Seraphim, these can cause low sex drive. They ding your hormones in a way that you don't feel very sexual. Whether you are taking those, I would talk to the doctor about switching you to a different type of antidepressant, which usually will improve your sex drive. One in particular that I know about is Wellbutrin. Women who are on antidepressants for whatever reason, whether it's PMDD or whether it's a situational depression, you can switch from some of those antidepressants and go to one like Wellbutrin. Now, this one will typically improve your sex drive, and sometimes we give it to women who have arousal disorders as well. Now, here's something I don't know nothing about, but I'm going to tell you all about it. I heard one time there was a famous person who was taking Wellbutrin, and she said, or I was told she said, so don't quote me on this. And girl, please don't call me. But if you want to call me because I like this person. But she would get spontaneous orgasms on this particular antidepressant. Now, don't go asking your doctor for Wellbutrin so you can have a spontaneous orgasm. But I was told she came off of another antidepressant or was taking this medication for some reason and would walk and go, ooh. Oh, so do know that some of the medications you're taking may be causing a low sex drive. Believe it or not, taking antihistamines like Sudafed, Actifed, they are good at drying things up. Girl, you know what else it can kind of cause some dryness with. So be careful with some of the medications you're taking, which can lead to some dryness, which can lead to some uncomfortable feelings with sex, which can certainly cause you not to want to have sex. But there are medications out there. There are herbs out there that you can take to improve your sex drive. And I will tell you, the FDA has approved a few medications for women to boost their libido. And one of them in particular is Addy, and it's spelled Addy. And it's a pill. You take it once a day at bedtime. Now, there are side effects to everything in life, from getting in your car, driving to work. There are side effects. But some of the side effects that Addy has listed includes low blood pressure, dizziness, nausea, and fatigue. Also, if you drink alcohol and you're taking diflucan, this can make these side effects even worse. So do know you may feel nice and horny, but you may have some side effects. But I will tell you, for the most part, medications will list the side effects, but they're usually not that high. But do talk to your doctor about it. There is another one, and I want to say it's called Vyleesi, or I'm pronouncing it wrong. It's Vylessi. Now, this one is actually an injection, and you actually give it to yourself under the skin of your abdomen or your thigh before you're ready to have sex. Some women still will have some nausea, which is most common after the first injection, but tends to improve with the second injection. You may have some vomiting, some flushing and headache and skin reaction at the site of the injection. But these are two medications that I would encourage you to talk to your doctor about and whether they would allow you to take these medications. Now, I think I said the FDA approved options for premenopausal women. These medications aren't FDA approved for the use of postmenopausal women. So make sure you are talking to your doctor about these medications. But other medications you can take, believe it or not, is talk to your doctor whether you can increase your estrogen and your testosterone. Now, in my practice, we use bioidentical hormone pellets for the most part of this, and take it from me. I told you I was telling my business right now. Girl, boy, these pellets kick in and you walking around thinking about your partner all day long. Now, this isn't the response with everybody because I'm telling you my business, not other people. But if you get an increase in your testosterone level, and for women, it's a minimal amount of increase, but sometimes increasing the estrogen and the testosterone level, which do come in the form of an injection for testosterone, but for estrogen, we have pills, patches, sprays, gels. But talk to your doctor because we do check these levels to see if increasing these levels will be important to you. Now, there's one other thing I have is Intrarosa. I don't know if I'm pronouncing it right, but it's INTRAROSA. This is a vaginal insert, and it delivers DHEA directly into the vagina, which helps to ease painful sex. This medication is put in nightly to ease the symptoms of moderate to severe vaginal dryness. Now, there is another suppository that I love, and you saw me all over Facebook talking about it. This one you order yourself. That one is really good with sex as well. There's another one, Osphena, OSPHENA. This is actually a pill, and you take it daily, and it will help relieve painful sex symptoms in women with moderate to severe discomfort during sex. This medication isn't approved in women who have had breast cancer or are at high risk of developing breast cancer. So make sure, again, you're talking to your doctor about this. Now, I didn't talk about it at the top, but I will tell you body image is really important. And your perception of your body is your reality. And if you don't like how you look to yourself, a lot of times you don't feel very comfortable with somebody else looking at you, and it will definitely ding your libido or your sex drive. So body image is really important. So I'm going to start with a couple of those things is exercise. Regular exercise and strength training can increase your stamina. It improves your body image. It will lift your mood because, honey, you are secreting those good endorphins, which are those hormones that make you feel good. Hence, you'll boost your libido. And stress less. Let me just be honest with you. Find ways that will help you cope with work stress, financial stress, and the daily, day-to-day hassles. Honey, your sex drive will go up. And I talked about this earlier, and I'm going to tell you again because I'm talking from a personal place. If you learn to communicate with your partner, if couples would just learn to communicate in an open, honest way, you usually will maintain a better emotional connection, which can lead to better sex. Have you guys ever gone out all day with your partner and you hung out at the movies or had a picnic? You just were together in a good way, no argument or anything. That's the best sex ever. So if your communication about life is good, then a lot of times your communication about sex is good. So communicating with the partner in an open and honest way. Now, let me side note, because I am not a therapist, but a lot of times you have to learn your partner's love language. You got to know when to talk to them, how to talk to them. And it's just important. I know if my husband is all stressed out about whatever is going on in his life, or I come in a stressed out way and my delivery is off, then it's going to take the whole communication off. So talk about what you like and don't like outside of the bedroom. Waiting till you get in the bed is not always the best place to talk about what makes you happy or not happy. But sometimes if it's right, say something. You know, I guess I'm a little hypocrite here. If it's not right, it's probably not a good time to say something, or give great directions. You know, move like this. Oh, that feels good when you do this. So communication is key. And then for me in my house, we have to set aside sometimes time for intimacy. My busy schedule, I get up early in the morning so I can work out, spend my quiet time, take my supplements, and fix something to take to the office. And so I'm up at 5. I go to bed late. I'm up usually on the computer or doing a podcast or something late at night. So we have to sometimes just slow ourselves down. And then sometimes we get very boring. We do the same thing over and over again. So you have to sometimes set aside time for intimacy. And I don't mean just sex. Intimacy, if you look at that word, that means into me. If you set aside some time to just be intimate, like I told you, hanging out together will give you some good sex. And then you have heard me talk about adding spice to your sex life. You ladies and guys have listened and you've told me you love it. But go back and listen to those podcasts on trying different sexual positions, different times of the day, different locations in the house. And I'm bad at that. You know, I like that to be my nightcap. But sometimes you have to add a little spice to your sexual life to get better sex or to even want to have sex. But you may have to do some experimentation, agreed upon experimentation with toys, and just, you know, go back and listen to my episodes on spicing up your sex life and get you some ideas. We may have to go back and ditch some of those habits that we have. Smoking has nothing positive about it. So just know that smoking interferes with everything, and everything interferes with your sex drive. Illegal drugs, crazy enough, that has been found to ding the libido as well. Excessive alcohol can also ding your libido. So think about getting rid of some of those bad habits that you may have that can help boost your libido. And then again, I'm going to go back to saying There are herbal options out there. There was one in particular. If you go back to my Dr. Jackie's Point of View and look at some of those supplements that I listed, I know I listed Tribulus. And crazy enough, that's found in the male section of some of your vitamin shops and even some of those expensive organic stores. You know who I'm talking about out there, but they have them out there. There's another one that's called Zestra. It's a botanical massage oil that you apply to the clitoris and the labia and the vagina, and it increases arousal and pleasure more compared to just doing nothing at all. There is another one, Avlamil, I think it is, Avlimil, and this product has an estrogen-alike effect on the body. And so it's not actually estrogen, but it'll hit those estrogen receptors. So I will tell you, be careful if you had a female cancer, especially breast cancer, that you are not using things that will boost your estrogen response without having talked to your doctor. And there are a list of supplements. Go to Dr. Jackie's Queen V and look at all of those that I have there. And then back to the coping and support again. Low sex drive can be very difficult for you and or your partner, but make sure if you need couples counseling, it will help. I do know when we were in counseling, it allows you to get things out there and you talk about it and you really discover stuff about your partner that you didn't even know was bothering your partner and how your response makes them feel rejected. Go for long walks, get some extra sleep, find some time that you can cuddle and get inside your partner's head, make a date night at your favorite restaurant, but just coping and support with each other will help. And getting prepared for your doctor's appointment, I would tell you to write down stuff. We like you to come in and not go, and you can't remember it. So when you're going to see your doctor, make sure you've made a note of those things that have been bothering you and take this opportunity to be open, be honest, and be transparent about your sexual concerns with your doctor. And if we don't bring it up, because a lot of times we get in and we talk about the kids, we talk about life and the pandemic and work. And sometimes as a physician, we forget to ask you about it. And then some patients, if you go back to Dr. Jackie's Queen V, may feel embarrassed when I bring it up and they seem like they don't want to talk about it. So even as the doctor, I have to approach this conversation based on a personality type. And so it is part of vital sexual health that you're having good sex. If that is important to you, it's a part of feeling loved and connected with the partner. So make sure, again, you take some notes on any sexual problems that you're experiencing. Make sure you tell your doctor about any new diagnoses that you may have been diagnosed with, like diabetes, hypertension. And crazy enough, we're learning a lot about this pandemic that may leave some residual effects as well because it's affecting some patients and their respiratory tree. So do talk to them if you're taking some new supplements or new medications or new vitamins. And then just, again, go in open and honest. But some basic questions to ask your doctor could include, what do you think is causing my problem? And I told you at the top of that, we're working to evaluate you to see if we can come up with an answer to that. And then even talk about if your level of desire is off. You know, there are some males who believe that they should be having sex every day, several times a day. I've talked to some women who enjoy that. And I have other patients who go, oh my God, I can't keep up with my husband, which leads to a problem. And then what in your lifestyle could you make an adjustment to improve your sexual desires? And I talked to you about some of those things you may be able to change in your life. And then ask about the medications. Then talk to your counselor and your doctor if there are books and materials out there that we could recommend that you read. And there are some wonderful counselors out there, and I've talked to a couple of them, but I think that you should definitely seek counseling in conjunction with seeing your medical doctor as well. Now, there is one last thing that I want to talk about. Like I said, there's so much more I want to talk about with libido, and I can go on and on. But here's one thing that I personally prescribe, and it has its necessary place in your life. But believe it or not, birth control can actually ding the libido. And you're like, what? But again, I told you there were other medications, but one big one in particular is birth control. If you're using a synthetic birth control, like a pill, a patch, a ring, or anything that's giving you estrogen and progesterone, it can impact your body in a way that decreases your libido. The birth control pill also can increase sex hormone binding globulin, which can again, tie up some of that sex hormone that you have there. It can decrease the androgenic hormones, and you just end up with less of a libido. In 2004, there was a review that discussed the findings from numerous studies about the relationship between libido and birth control, and it showed that women who took oral contraceptive pills experienced a low sex drive compared to those women who didn't. With all that being said, though, birth control pills still have a place. So I'm not telling you to go stop taking your birth control because, again, you go from one dinged libido to another, which means you're pregnant and you have kids. But they have definitely a place in that they regulate your periods. They decrease acne and prevent unwanted pregnancies. But remember, there are natural ways to rebalance those hormones so your libido will return to normal level. But I just wanted to add that it can certainly ding your libido in that it decreases the production of the androgenic hormone, which decreases your sex drive, and it increases the production of sex hormone binding globulin in your liver. And this protein binds the testosterone, the androgenic part, and it prevents it from circulating and being used throughout the body, hence decreasing your libido. But I'm going to take you back to saying there are ways to rebalance this, so don't stop using your birth control without talking to your doctor. There are other birth controls that you can switch to. There are non-hormonal birth controls out there. There are other medications that may actually amplify the fact that your libido is decreased, like I told you, your antidepressants and your anti-anxiolytics. You may have to try relaxation therapy and foreplay therapy to boost this back. But again, don't just stop your birth control. But I wanted to add to you that birth control certainly can decrease the libido. As I just told you, don't stop your birth control because there are ways around working with birth control. So there are some natural ways that you can boost your libidos for both the men and the women. And I'm going to just share. I talked about managing your anxiety. And there are some things that I may not have mentioned, but I'm just telling you, sleep is a factor. If you are not sleeping at night, nothing else really works well in the body, but practice good sleep hygiene. Make time to exercise regularly, as I've said. And this I didn't mention, but a good diet. A nutritious diet is important as well. And then, like I keep telling you, managing anxiety may involve seeing a therapist. Since I'm speaking of a therapist, sometimes you may need to include your partners in your therapy sessions. I will recap that. It has made a world of difference in my own personal life. And I'm going to tell you that many people experience a lull in their sexual desire, but the other person may not even notice it. And so including your partner in there, because again, your perception is your reality. So make sure you are improving your relationship quality, and it may definitely involve seeing a therapist. And then something I didn't mention, but I'm going to send you back to my other episodes, is focus on foreplay. Now, I'm going to just be honest, and my husband's going to beat me up for telling this, but men just get in and get right to it. For women, we need you to stroke us a little bit, say something sweet, play some music, touch us and kiss us and hug us. And then, man, we need y'all smelling good. So that is a part of foreplay for women because smelling good is so important. According to a research study that was also done, around 18% of women orgasm from just intercourse alone. So we need y'all to get us going, stimulate the clitoris. The anterior vagina is where the believed G-spot is. So touch us, hug us, hold us, kiss us. And then, like I told you, get you some sleep, eat healthy. Make sure if you have any medical conditions like hypertension, diabetes, that your doctor is hearing that as well, because medical conditions can disrupt good circulation, and you need good blood flow going to good places to make sure you're having good sex. And as I mentioned, your tribulus, your ginkgo biloba, maca root, all those are good hormones as well. Exercise, get those endorphins going, and maintain a healthy weight. We talked about it because it definitely impacts your psychological effect on how you feel about yourself. And that definitely will lead to good sex. And then all the bad stuff I told you to quit doing. Stop smoking. Decrease your alcohol intake. Also decrease some of the caffeine intake. Be careful with drugs. Now, I know marijuana is legalized in a lot of places, but if you've noticed a drop in your sex drive and you're smoking a lot of marijuana, maybe you need to cut back or cut that out because it can definitely impact your health. And so, guys, I have given you from the Rudy to the Tootie on low sex drive, mostly in women, but for all people. And I'm just going to recap for you from the Rudy to the Tootie. Make sure, one, you consider your sex drive as low, or as a couple is considered low, because there are people who are fine with having sex once a month, once every 3 months. But make sure you do talk to your physician. I think this is something you should go in with a list and explain to your doctor some things that are bothering you and mention your low libido. But I'm going to tell you now, before you get to your doctor, identify some of those things that psychologically that could impact your sex drive. If you're stressed the heck out, if you're in a bad relationship, if there's some situational depression going on due to a loss of a family member or a recent divorce, go in knowing that some of these things are factors. But you identify and talk to your doctor about it. Your doctor will definitely do a thorough history, asking you the what, when, where, why, and how, to make sure that we identify things that we could point out that could be an impact. We will do a thorough physical exam, which is important. And when I talk about physical exam, I also talk about body image. And I've mentioned to you thoroughly that body image is a factor. So after your thorough exam, we will, in a lot of cases, draw blood work to see if your hormones are thrown off. The thing about premenopausal women is your hormones fluctuate throughout the month based on where you are in your cycle, but we will check those hormone levels, thyroid, diabetes, hypertension, other things that could impact you. And then I am going to say, I think in conjunction with seeing your medical doctor is to consider seeing a therapist as well. And we went through medications you could talk to your doctor about and see if you are a candidate for those medications. I've listed those supplements out to you and told you to go back to Dr. Jackie's Queen V book and look at those supplements as well. Some things you can do physically, like working out. We've talked about things to stop doing, and never forget a good diet, exercise, and plenty of fluids can make a difference. So this has been a recap of what can help you with your low sex drive, or identifying if you even have a low sex drive. So that's just a tip of the iceberg on decreased libido. I could go on, and I think I'll come back in an episode on how to boost the libido and some natural methods for both the males and the females. But this has been another episode of Dr. Jackie's Point of View, talking about low libido. Thank you for listening. You can catch a new episode of my podcast every Thursday. Please don't forget to subscribe so you don't miss any of the action. I want to hear from you, so please leave a rating and a review. Follow me on social media for all the behind-the-scenes action and more at The Real Dr. Jackie on Instagram. See you next week.